Hello, I am going to speak today with respect to deductions and reimbursements under the Canada Health Act. Folks will remember with respect to diagnostic services last year that we were in a circumstance where a lot of Canadians were being charged for diagnostic services that they shouldn't have been charged for. The public nature of our healthcare system is absolutely essential. It's essential that Canadians, when they go to get care under anything that's covered by the Canada Health Act, that they not pay for those services. And there were a number of different instances where provinces were charging, and so we had to place deductions in place. Today, we were able to release both the reductions and the rebates that had occurred. I'm pleased to say that for most jurisdictions, more money is flowing back to provinces than they are being charged in reductions, which means we're seeing the right direction. And I have to say, in the conversations that I'm having with my provincial and territorial counterparts, we're well on the path to eliminating a circumstance where patients are paying for care, which is entirely inappropriate. There are a couple of instances where the amounts that are being deducted are still higher than the reimbursements. We're working hard to get those areas fixed. But on aggregate, this is very good news, and I think it's an appropriate use of the Canada Health Act to ensure that we protect the public nature of our system and that people aren't paying out of pocket for the services that they need.
Can you tell us which provinces have been clawed back and for what?
Sure. So there are 9 provinces in total. The vast majority of these are for diagnostic services. In some cases, the amount is very small. So if I take Manitoba as an example, we're only talking about a few $100s. But if we're looking at all of them together, the deductions and the rebates, most provinces come out ahead. They're actually getting more in rebates. So there's only 3 provinces that are in the red, if you will. That's Nova Scotia, New Brunswick, and Saskatchewan.
I pop quizzed you there.
Yeah, sorry, it took me a second to remember Saskatchewan. Apologize.
Do you have details for Quebec in your little
Oui, il y a le chiffre pour Québec, c'est là. C'est plus, le tas d'argent est 10 millions de dollars, presque ça. C'est pas exactement ça. Plus, c'est pas moins.
Of what they're
So
getting
10 million
more than what is being clawed back.
So they're basically getting 10 million more in reimbursements than is being clawed back. And in the case of Quebec specifically, really good progress has been made working with the government of Quebec to sort out, the costs that were being charged to folks for diagnostic services. So we've seen now a lot of that money reimbursed, which was, I think reflective of the work you saw in the working together agreements as well. We have an agreement in principle with Quebec. So we've been able to work through some of these issues, this being one.
Is it all on diagnostic, or are there other areas of...
For Quebec, it's specifically for diagnostic services.
Okay. Can I... Go ahead.
Sorry.
You're on a roll.
Yeah.
What circumstances, I guess, led to the clawback? Is it that they're, private clinics, more in those 3 provinces, or why did they stand out?
Well, the specific issue of concern for us is that patients don't pay. So if you're a patient and you're walking in and you require care, or in this instance, diagnostic care, so that you can get diagnostic services, you shouldn't be paying money to get those services. So there were, in a variety of different provinces, instances for diagnostic services where patients were out of pocket for procedures that should not have cost them any money. So that's a violation of the Canada Health Act, and that's why we levied the charges that we did. But as I say, the trajectory now is that we're seeing a receding of that as a tactic, and we've been able to largely reimburse, and that reimbursement means that the patients themselves were reimbursed, right? Which is what we're seeking here.
Are you considering clawing back money at all as it relates to trans healthcare and being able to access trans healthcare?
It's essential that every Canadian get the care that they need. And I was just in the Yukon where they are a leader in North America in providing care for trans people. And it is so tragic for me to hear the stories, particularly of young people, when they don't have access to care. It leads to death in way too many circumstances. So we're having conversations, I mean, as you've seen in the working together agreements, frankly, in dealing with diagnostic services, working in a spirit of collaboration to try to work with provinces to ensure trans kids, as an example, get the support and care that they need. So I've been having conversations with some jurisdictions where we have a very different view than we do. But my preference at this point in time is to work through that on the basis of collaboration. We do respect the elected authority of provincial governments, but there are some things when you're endangering the health of children, as an example, where we're going to have to look at in the first order at collaboration and trying to work through that, government to government to sort out our differences. And I don't want to engage in a hypothetical if that doesn't work, but I am deeply concerned.
But on that clawing back is an option.
Well, I think, we'd have to look at it. The Canada Health Act says that Canadians must have access to the health care and services that they need. So, I think that you can imagine, I really do respect provinces. And, in the conversations that I have with them, we've been able to work through some really hard things together. And frankly, these deductions are an example of that. And so my preference is not to, walk around with threats or a stick. My preference is to say, let's come to the table and look at the evidence and data and let that guide us in our decision. So I know what you're saying.
Understanding, though, that is an option, though, to claw back money if
Yeah, I mean, it's an option on the table.
Monsieur le ministre, concernant les transferts canadiens...
So, pardon, c'est pour la première fois, là. OK. Okay, sorry.
When Premier Smith announced her policies on trans kids and hormonal therapy and surgeries, you actually came out here and did threaten to claw back money.
Yeah.
But you said you had to study the Canada Health Act because it wasn't clear if those health services are supposed to be publicly, not supposed to be, but are publicly covered or not. So it's been weeks, so I guess our question is, have you checked? Is it under the Canada Health Act?
Well, but I think, yeah. So, I mean, we have to be very careful because the interpretations that we make are forever. And, is it an option to consider? Absolutely. Should or can it be deployed is something that we're still looking at. But I will reiterate what I said before, which is the best answer is a collaborative one.
I get it, but you weren't sure that those health services even would fall under Canada Health Act and therefore be subject to a clawback. Have you clarified that part?
So one of the things, and I understand that this moves more slowly than I would like or you would like, but as an example, there's a forthcoming interpretation letter with respect to virtual care. There's many new frontiers in health where we have to be very careful in how we examine that, because once an interpretation is made, it's permanent, and it has a very long-lasting effect, and we have to make sure that legally it stands up to challenge.
Do you have a timeline on finding out?
Well, I think here's what I have a timeline on. Yeah, I don't have I know you're looking for a specific date. As soon as possible, but I would say that the most pressing and important issue for me is really the heart of your the earlier question, which is, do kids that are trans get the health care and support that they need? And we know that is an incredibly pressing issue because the evidence states overwhelmingly, if you have a trans kid who does not get those interventions and support, there's a horrifying number. The stat, I don't know the exact stat, but it's a horrifyingly high number of kids who take their lives. So this is really serious stuff. And these are not an area, and I think we've done a good job in other areas of healthcare of sort of setting aside partisan and political differences. The health of our kids can't be political. It's got to be rooted in data and science and evidence and what's the best things to make sure they have the best outcomes possible.
For that data, these kids don't know if they can get care.
Well, that's not acceptable.
Which is my question of your timeline.
Well, so that's not acceptable. So we are talking with provinces in which this is an issue about solutions and trying to find them collaboratively. Sorry, and I want to go over here.
Oui, mais c'est sur un autre dossier où les interprétations divergent entre une province, le Québec, puis Ottawa sur les transferts. Le gouvernement du Québec dit qu'il n'y a pas de conditions en échange de 900 millions de dollars par année. Est-ce que c'est le cas?
Ça joue avec le mot, je pense. C'est parce que c'est une certaine personne va dire les bouts communs, ça c'est les mots que j'utilise, et il y a des autres personnes qui disent conditions. C'est l'idée et de coopérer avec un esprit de coopération. Et nous avons signé une entente de principe, et comme tous les autres accords, il y a des mesures de responsabilisation, par exemple, et de transparence différence pour atteindre des objectifs. Et ça existe dans tous les cas. Et c'est tout le temps, il y a une question de juridiction. Je respecte les juridictions provinciales énormément, mais c'était possible au Québec, mais aussi en Alberta ou en Saskatchewan à lundi, de trouver une entente avec un esprit de coopération. Et l'idée d'avoir les indicateurs communs de montre clairement l'impact de l'argent fédéral dans le système provincial et aussi de s'assurer que il y a une continuation de collaborer sur les enjeux généralement.
Vous souhaitez avoir des indicateurs. Le ministre québécois, Christian Dubé, a un beau tableau de bord. Il y a certains chiffres d'ailleurs qui ne sont pas exacts. Mais vous voulez seulement les indicateurs, les données. Vous ne voulez pas diriger l'argent. Il n'y a aucune condition. Où va l'argent? Les 900 millions, Québec peut les dépenser comme il veut.
Non, il y a beaucoup de flexibilité dans chaque entente avec chaque province et territoire. On a dit que c'est essentiel d'investir dans les médecins, l'infirmière, l'accès le soin de santé pour les personnes. Et alors, à l'intérieur de ça, c'est possible de trouver des objectifs individuellement pour chaque province et territoire. Et c'est la raison pour laquelle il n'y a pas beaucoup de friction sur ça, parce qu'il y a beaucoup de flexibilité. Et c'est absolument essentiel que la flexibilité est là pour chaque province et chaque territoire, parce que la situation dans chaque communauté est absolument différente. Et c'est pas convenable, pas du tout, pour le gouvernement du Canada de dire ça, c'est la priorité pour vous. Et alors, avec un esprit de coopération, je dis OK, il y a des priorités majeures, et à l'intérieur de ça, dis-le-moi, qu'est-ce que c'est les choses qui sont importantes. Et ça, c'est le même entente avec toutes les autres provinces. Et alors, ce n'est pas une question de conditions, c'est une question de coopération, et aussi de s'assurer que pour chaque province et territoire, il y a des indicateurs communs. Alors, c'est possible pour les personnes de voir dans leur système de santé qu'est-ce que c'est notre progrès et qu'est-ce que c'est la différence entre Québec ou une autre province, par exemple. Et c'est possible, par exemple, dans l'exemple de Québec, il y a plusieurs indicateurs, plus que le 8 qui sont communs. Et ça, c'est excellent. Mais c'est important de s'assurer qu'il y a des choses qui sont communes partout au pays.
Why doesn't access to healthcare for trans kids fall under the Canada Health Act? Does it come down to a matter of outdated language, or what's that ambiguity?
Yeah, I mean, I think there are a lot of things that, when we created the Canada Health Act, we didn't contemplate. Virtual care is one of them. We're just talking now about diagnostic care. And it's fair to say that trans kids weren't on the radar on its creation. And so these interpretations are, each time I understand it's frustrating that we encounter a sort of a new frontier in healthcare, and this will continue to happen, by the way, that we're going to have to treat the document, the Canada Health Act, as a living, evolving document to adapt to these circumstances. My charge is to make sure that the Canada Health Act evolves in a way that not only recognizes the challenges today, but does so in a way that can hold up to both legal and political scrutiny in the future, so that we're not getting an act that is, being changed left, right, and center all over the place, but is steady and consistent. And I want to make sure that we do that as quickly as possible. And that does not mean that while we examine that issue, that we're leaving trans kids on their own. We're having active conversations with these jurisdictions to make sure that they're doing what it takes to make sure that trans kids get the health care that they deserve and need.
So you're considering changing the act?
Question.
Well, I think I'm considering changing the act every day. And I just give you an example in virtual care in the upcoming interpretation letter. It is a living document. It is not a static document, and it's one that I'm committed to evaluating on an ongoing basis to make sure that it's meeting the needs of our healthcare system, our publicly delivered healthcare system.
Sur les trans, est-ce que vous allez modifier la loi ou non?
Oui, il y a toutes les choses sont possibles, mais je n'ai pas les choses de dire aujourd'hui sur ça. OK. Merci beaucoup.
Merci.